Hey there. Do you have abdominal pain or bloating, gas, any type of intestinal issues that have been going on for a long time and you've had trouble getting them diagnosed? Have you seen multiple physicians and received multiple prescriptions for pain medications and nausea medications, but the symptoms never seem to change and you're having trouble finding out what is the problem or what is it that is creating this issue for you? Have you seen and had colonoscopies done and endoscopies done and other things and been put on different medications? Or maybe you've even received a diagnosis of irritable bowel syndrome or Crohn's, ulcerative colitis, but you've not yet had surgery and you are trying to establish a medication regime that actually keeps your symptoms at bay so that you can live your life with some sort of uh, uh, comfort and some sort of control of some of your symptoms. If this describes you or this is sounds familiar to you, then I would really love it if you would reach out to me. I want to tell you that there's a better way. My name is Dr. Christina Campbell. I am a functional medicine physician. I've been practicing medicine for over 20 years, and I want to tell you that there's a better way than chasing the medication regime and multiple physician visits and never being diagnosed, or even if you are diagnosed, never really changing the symptoms or how you feel. And if you feel like sometimes you're crazy, that it's all in your head, or you're telling your doctors these things and they're just saying, well, here's another prescription, or it'll go away, don't worry about it, but it doesn't ever seem to go away, or maybe it does and it comes back on and off, kind of like in an oscillating rhythm. These are things that a lot of people go through who have irritable bowel syndrome, inflammatory bowel disease like Crohn's and ulcerative colitis. And I can tell you, I know exactly how that feels from firsthand. I was diagnosed with Crohn's disease when I was 12 years old. And I went through the ringer of all of the tests and the repeat tests and medications and trying to find a medication dose that would keep my symptoms at bay so that I could function in my daily life. So I could go to school and I could learn something and I could get somewhere in my life. And really was on medications for many, many years, and fearful, of course, of the next what's going to be the next disease that I develop, or what's going to be the next thing that comes at me because of this chronic disease that I have since I'm 12 years old. And a lot of things are thrown out by physicians. Your risk of colon cancer is through the roof compared to the normal everyday person. And, those are things that kind of loom they loom out there in the universe in front of you, and you're just kind of waiting to get hit with it. Or the idea that, you have one autoimmune disease, you're probably going to get one or two more, which is very, very common now because we're not actually treating the root cause of the first autoimmune disease. And that's the problem. We're allowing the root cause to continue on and brew underneath the surface while we're just covering the symptoms with medications. And I'm not saying there is not a place for medications. Obviously there is. I mean, it helps control those symptoms, right? But we really have to get down to the root cause of what the problem is and fix that, because you're never going to improve and you're never going to get better. You're never going to reclaim your health without it. And that may be a surprise to you that that's even a possibility. It was for me. It was a surprise to me when I found out, oh my God, I don't have to live this way. And you don't. So I'm here to provide you with some understanding that there is hope and that I'm here to help you. If any of this description sounds like something that you're going through, or someone who is going through this, please share this video with them. Please reach out to me. In the comments below, I'm going to put a link to set up a free call with me, and I will even send you a little questionnaire to fill out ahead of time, just to kind of get an idea of what's going on with you. And it's a really cool questionnaire that helps to kind of pinpoint some of the areas that you are having symptoms, and quantify that so that we can kind of get to the root cause of what's going on with you. I would love to be here to help you. I would love to help you. I'd love to have a free call with you and just kind of give you an idea of what's going on, and to share with you some of the things that can be done that can help you reverse some of these diseases, and it's certainly to prevent any further development of further disease down the road. This is so important, and I really want you to have a healthy and wonderful life where you're pain-free and you're able to live a life that you enjoy with your family and friends, and not have to be suffering and not have to be always covering up for symptoms or canceling events because you're so uncomfortable, or all of the social things that come with inflammatory bowel disease. And it can be a very difficult life to live, very difficult. It is not an easy disease, and I want to help you to make it easier, to make it better. Please reach out to me. I'm looking forward to talking with you, and just know there is hope and there is a better way. Give me a call.